Thank you so much for joining us this afternoon. I'm excited to introduce our panel of experts and start talking about what it takes to apply some of the technology that we've heard a little bit about this morning, all the way from infrastructure strategies related to public cloud and colo. Also get into what it takes to deploy some of these AI models into the clinical practice, and then finally talk about some of the industry trends and the emerging technology that we see throughout the ecosystem today. So first off, I'm joined by Christian Lindmark, who's the Chief Technology Officer at Stanford Health Care in Palo Alto, California in the United States. We're also joined by Gary Fritz, who's also a member of the Stanford Health Care team and the Chief Application Officer. Both Gary and Christian have been with Stanford for just over 8 years and have helped them help lead the transformation journey to bring Stanford to where they are today. And finally, we have Dr. Khan, who's joining us from AWS, who's on the global healthcare team and is a physician executive, primarily focused on artificial intelligence and machine learning. So Christian, I want to start with you, and maybe you can give the collective audience here a little bit of background on the size and scale of Stanford, and then get into the infrastructure strategy that you've gone through over the last 8 years and some of the lessons you've learned along the way.
Great, Kevin. Thank you very much. Hope everyone can hear me. Thank you, Dubai. What a wonderful city. My first time to Dubai, and we've absolutely had a blast since we've been here since Saturday. Very excited to be here today. So a little bit about Stanford Health Care. So Stanford Health Care is an academic medical center located in the San Francisco Bay Area. We serve a population of about 8.5 million people. Every year we see about 1.5 million patients through our 2 inpatient facilities, which make up about 850 beds, and we have about 200 ambulatory facilities and clinics throughout the Bay Area as well. The mission of Stanford Health Care is to heal humanity through science and compassion, one patient at a time. And we do that through providing world-class patient care, educating the next generation of physicians, and our discovery and research. Stanford Medicine is made up of Stanford Health Care, the Stanford School of Medicine, and Stanford Children's Hospital. We are ranked annually as one of the top medical facilities in the United States and globally. And we're really known for cutting-edge research and innovation, treatment of very complex cases, and disease management. So that's a little bit about who Stanford is and what we are. Talking about our cloud journey. So I became CTO in 2017, and my infrastructure team came to me and said, Christian, we need to solve a problem. We have a very outdated data center infrastructure, and we need to be thinking about the future. So at the time, we had 5 data centers. They were located all across the United States. We had siloed tech stacks. We were not running as efficiently as we could. We were having more outages than we would have liked with our systems. But we needed to find a way to sell this to the board to get funding to move forward. At the same time, we were building a new $2 billion hospital, state-of-the-art. We were about 2 years away from completion, and we had a new C-level leadership who was putting together a new integrated strategic plan. And so we had to find a way to highlight the importance of our cloud strategy amongst these other things in the organization. And so my team and I worked on a way to put this plan together. And we went to the board and we said, hey, we need to plan for the future. We need to consolidate our tech stacks. We need to think about the cloud, whether it's the public cloud or the private cloud. And we need to think about sustainability, another really important thing for us at Stanford to consider. So we took this to the board in 2018 and we got their approval to move forward with our data center and cloud strategy. What we really knew from the beginning is that we did not want to be in the data center business. Our job was to take care of patients. We did not want to run and operate data centers. So we knew from the beginning that our plan was to go out and to find partners in the industry to host all of our systems, whether that's in the public cloud or whether that was going to be a private cloud with one of the colo partners. So we put an RFP out, and we found the most sustainable co-location facility in the United States who had net zero carbon footprint, and they became our partner. So that was really one of the core things that we did right out of the beginning. And then we looked at our application stack, and we have over 600 critical clinical applications that needed to be migrated out of our data centers. And we went through and we decided, do we need all these applications? Can we rationalize them? And how can we build a better infrastructure, a shared infrastructure that can support them? So that was step number 2. And that was really, really important. The third thing we did is we looked at, can we take any of these systems and move them to the cloud? And our first priority was SaaS. If any of our vendors are offering a SaaS solution, we want to take advantage of that. And so we sat with each of our vendors and we understood their roadmaps to understand, were they going to be SaaS soon? If they weren't, were they going to support the public cloud? And I think we all know the challenges in healthcare over the last 20 years. Many of our vendors are behind with their technology. They weren't built to be cloud native. And as they look to upgrade their systems, they often fail in many ways to make them ready for the cloud. So it was really a difficult journey to get through all of this, but I'm proud to say in 2022, we completed our data center journey, and we actually built a private cloud environment. And that private cloud is not just our data center. When I think about private cloud, we have the same tools and capabilities in our data center that most of all the hyperscalers do. We're able to spin environments up and down. We have consolidated tech stacks. We've automated functions, and we've allowed ourselves to run very smoothly. We've actually reduced the number of P1s or Sev1 incidents by 50% since we completed our data center consolidation, which is extremely important. And then we also reduced the cost to run our data center facilities by over $2 million a year annually. So we found significant savings implementing this. The downside, and the thing that we weren't able to accomplish, was really moving more and more of our tech stack to the public cloud. And honestly, it was just because it was too expensive on an infrastructure as a service basis to move from on-prem to the public clouds. So as we look at things today, we're about 60% on-prem in our colo facilities. We're 40% in the cloud. But of that 40%, I'd say 95 is really SaaS-based. The other 5% are just the small things that we move there into our public cloud environments. And some of those have been our DR environments. So for instance, we took Citrix and we moved our Citrix DR environment to the cloud. There was no reason to have our Citrix DR environment fully stood up sitting on-prem. So there was a huge savings by moving that environment into the cloud. Now what we're doing is we're thinking about 2030 and where do we need to be? And I firmly believe in the next 6 years, 90% of our environment will be in the cloud. I would say 60 to 70 will be SaaS-based because more and more vendors are moving towards a SaaS-based solution. But I believe the remaining 20% will be in the public cloud. And I believe that we're going to have to do that because there's a couple reasons. AI is number one, and AI in infrastructure, we will not be able to continue to support and buy, procure, and have skill sets of individuals to maintain that hardware that is now coming AI enabled. So we can take advantage of the hyperscalers who have a greater advantage than we do in that area. So I think that'll be the reason we're going to see that shift, and that's what we're planning on now. And I think the things that we've done really, really well is we've built key strategic partnerships with the Amazons, the Microsofts, the Googles of this world. We meet with them regularly. We're understanding their roadmaps. And I think the thing everyone should keep in mind as you're planning is, what is your data architecture strategy? I think your data architecture strategy is going to really drive the decisions you make on where you want to put your data in the public cloud, where your data resides in the SaaS models, and how you're going to be able to take that data from an analytics standpoint, look at it, and keep your costs down. So that's what we're on now. We're on phase 2 of our cloud journey, and we're really excited about where we're going.
Fantastic. Thanks, Christian. And I love how you lay out it's not a singular technology strategy, right? Or it's not just a 2-year plan. You're talking 2030 and having that forward-facing mentality, which obviously helps the organization stay on the front foot. With that, Gary, we just started to introduce some of the AI conversation. Could you talk through a little bit about your deployment strategy for artificial intelligence specifically, and maybe hit on how the architectural and infrastructure strategy Christian just went through supports and enables that?
Happy to do so, thank you. Good morning, all. So it's worth remembering, I think, that Stanford has 2 personas. One is academic medical center, or excuse me, one is academics. So we are training doctors and doing cutting-edge research and development in the School of Medicine and the other schools of Stanford University, so computer science and engineering, biomedical, other places. And then we've got the healthcare side. So Stanford Health Care is the place where the technologies come for first use, and we also take care of patients in a number of different ways, 1.5 million per year. So from an AI perspective, we have two missions. One is to create an environment where our clinicians and researchers can create new models. Cloud and AI are tightly coupled because of that. So in order to have a large-scale model development and training environment and execution environment, it really only makes sense in the cloud. So we are training at any given time dozens of models on standard data sets, large data sets, but standardized ones that are protected in our environment. On the healthcare side, we're currently running dozens of relatively small predictive models in the environment, enterprise-wide, about 20 large ones, and most recently 2 Gen AI models that are showing an awful lot of promise, and they're being deployed broadly. So our cloud strategy relative to AI is build and run in the cloud and manage it in a consistent manner that will allow you to protect both the patient data, the IP that we're using, and control our costs, which is an important part of model development and execution.
Fantastic. Thanks, Gary. Dr. Khan, I want to transition to you, and obviously we just heard a lot about some of the practical things in place at Stanford and some of the core activity that needed to take place to get from where they were to where they are. Could you hit on some of the industry trends and some of the things you're seeing at a global level, obviously beyond the United States as well, and maybe provide some context in what you're excited about in the next year or two?
No, thank you so much, and really excellent to be here. So building on Christian and Gary's comments, when we look at something like the Gartner hype cycle, it's still a little bit early, right? We're still at that kind of increasing state of where everybody wants to do something with AI, ML, and healthcare, yet the practicality is that not many folks are bringing these things to production. But as we're seeing with our customers and our partners, and as we look at the world through the eyes of AWS, we're really trying to make investments to make that a lot easier and to make it a lot more scalable and efficient. You know, one of our leadership principles is about with the growth that we've had, that we approach things with looking at things for sustainability reasons. For example, about 20 or so questions to these models can burn through about a whole bottle of water, right? And you can think like per person, per organization, that just like scales up incredibly. How can you as an organization maintain the costs around that? And that's why as AWS, we're making significant investments on, say, building our own chipsets that are way more cost efficient, that don't use that much water. So I think looking broadly, I think there are a lot of opportunities moving forward as more and more of these models come into the cloud, mainly because they kind of have to if you want to grow and scale at that rate. And at the same time, too, that we learn from our partners such as Stanford and through Nordic as to what best practices are. If you throw all these models out there, there's millions of them, it's going to be very confusing for the user to make sense of them, right? So I think aggregation and I think accumulation, I think in this sense, is what we're really seeing happen right now.
Fantastic. It's always good to learn from one another and share some of the lessons learned, so I'm glad we get to do some of that today for this collective audience as well. Gary, I want to transition back to something that you hit on as it relates to the deployment strategies, and maybe you could hit on some of the best practices that you folks have been implementing as it specifically relates to the AI models in practice.
Sure, happy to do so. So if you can imagine, so Stanford has about 1,250 applications in production in our environment. About 40% of them are already running in the cloud, although that understates the value of those applications. If you're a third-party software vendor selling to us, for example, you may have sold us a product 3 years ago or 5 years ago that's on-prem, and you're having increasing difficulty keeping that application current. And now with AI, which has exploded onto the horizon, you want to build models into that application, but to keep it relevant and also add value. So in order to do that, you are probably thinking about moving your code base to the cloud, to the SaaS model, and changing the way you sell your product. There's an economic component to that. There are lots of reasons to do that from a third-party vendor perspective. So the reality with packaged software is it's going to the cloud either as a SaaS model or in a public cloud function that you're remote hosted or controlled. That means that you have to understand how the AI models will function in that environment, and you'll have to figure out how you're going to bring them into your portfolio in a safe way. Now, SaaS AI applications and homegrown ones have the same problems. So thinking about a responsible AI lifecycle is super important. It's absolutely vital. It will protect the patient first and foremost from bad models and bad outcomes, but it also will allow you to understand what the ethical considerations are, what the financial considerations are, and how you manage those systems. From a general management perspective, AI is not much different than application development life cycles. So understanding how you evaluate the products, the new applications that are coming in, how you manage them, train, monitor them, so you'll have to learn about model drift and how important that is, which is extremely important, and how you'll bring it in over time. So from a product management and cost perspective, having a single place you can manage these and a coherent strategy around watching the success of the model, watching the outcome, and having discipline around saying that model or that application isn't working, we need to just decommission it, which we do. So that's an important part of managing the strategy and managing the cost. Those are questions to ask your third-party developers, certainly questions to ask your internal development team as they build out if you're building out their systems. And it's an even more complicated discussion with Gen AI.
Yeah, hey, Kevin? Yeah, if I could just add to what Gary said as well. I mean, we're all at the infancy of this as well. I mean, there is a lot to be learned. So as we think about, the best way to monitor the models that we're putting into place, the best way to monitor the costs. This is one of my biggest concerns as Chief Technology Officer and monitoring these environments and running these environments is, people want their own subscriptions. They want their own landing zones. We turn them on. They want copies of data. What is that governance? How are we monitoring what they're doing? How are we ensuring that the costs aren't scaling out of control and ensuring we have those right guardrails in place? It's extremely important. And I suspect we're going to fail along the way. And I hope when we do, we can share that information with the broader community and say, hey, here's where we failed. This did not work well. Don't follow in our footsteps. I think that's one of my biggest frustrations within the healthcare community as providers. We're all working on the same problem, but we often don't do a good enough job of sharing what's working well and what's not working. And so we often all repeat the same mistakes. And as we all know, especially in the US, the cost of healthcare continues to skyrocket, and we've got to find ways to bring that cost down. And so I think we've got to do a better job of sharing with each other what we're doing, what's working well, just so we don't repeat those same mistakes. So again, this is new. We're at the infancy here. It's very, very exciting. Obviously a lot of hype around it, but we will make mistakes along the way, and we just have to ensure that we learn from those and put guardrails in place as we continue to move forward.
So just one last thought on that, and Christian and I address this all the time from different perspectives. So models that are basically discrete data have one operating model. If you're implementing AI in the imaging space and you're using extremely large data sets with complex images, you have a whole different economic model. So thinking about how you'll manage those environments is super important. For example, we have a digital pathology system. We scan 100% of our slides. At Stanford, that's about 1.2 million slides a year. That's roughly 2 petabytes of new data per year, just digital pathology. So where you put that and how you manage it is incredibly important. So storage costs become really critical, and both training the models and executing them on these large data sets can become difficult to manage. So a really good discipline around what you understand your use cases to be, whether you're getting value out of them, and not replicating use cases. We can pay for 1 2 petabyte data set per year plus a backup. We can't pay for 2 or 3 or 4 or 5 for different use cases. So having a coherent strategy around all your data management and storage in particular is super important.
Yeah, I absolutely agree, and I think building on many of those ideas as well, for us and being AWS, we're absolutely customer obsessed. We like to work backwards from our customers, and one of the things that we continuously hear is, how do we do AI governance? Like, what is the appropriate way to do that? And I think to Christian's remarks earlier, there really haven't been great collaborative forums for that. I think that's just starting to emerge within at least the United States. But we're seeing, I think, really impressive, studies come across internationally, like really great study out of University of Queensland, all about salient AI. How do we actually set up a framework to go step by step from conception to production to then being able to monitor what's happening? Again, from AWS perspective, we create tools and services to help with that, whether it's through SageMaker, Clarify, or what have you. But again, I think the end goal is that everyone is kind of asking for the same thing, and I think we're just about getting to that state where we can share and actually collaborate.
Appreciate all the commentary there, and I want to double click into one aspect that we've kind of touched on adjacently throughout the conversation today, and that's organizational buy-in. Sometimes we hear about the myths that if you buy the technology or that if you have a singular champion, in some cases you can make some good progress, but that's not the entire story, right? And so, I don't know, Gary, maybe you want to start with some of the organizational buy-in, or Christian, you talked about how you had to go all the way to the board for approval to really be open about what needs to take place to be able to get to where the collective organization needs to go and who needs to be involved. When do you want to start? And then Dr. Khan, I'd love your feedback too at the end.
No, please go.
Okay, so I would suggest that there's too much buy-in at this point. So the hype in the short run is just off the charts. Everybody wants to do a model. Everyone wants to develop a model or become prompt engineers. That's happening all over at Stanford, as you'd guess, for a variety of good reasons. So the issue is, how do you put up the right guardrails to be responsible? So the responsible AI coalitions that are being formed in the US and certainly globally are incredibly important to solving that problem. So in the US, 4 academic medical centers, so Duke, Mayo, Johns Hopkins, and Stanford, have formed a coalition to come up with foundational models and a responsible AI development and management life cycle that will provide some industry guidance in this area. And most recently, there's really serious discussion with the cloud vendors and with the federal government around building a small number of national labs that will allow AI developers, vendors, to put their model into the environment and test it against standardized data sets that are as free from bias as you possibly can get it. So lots of work happening in that area. It's incredibly important to solve the problem of bias in healthcare, and it's, as you said, we're in the early days, but there are good thoughts happening in that area. So buy-in is not as much of a problem as you think, for us at least.
Yeah, I mean, I agree with everything Gary said, and shifting away from AI, maybe back to cloud or other application deployments. I mean, it's critical to have that buy-in through the organization. You never want to feel, no one wants to feel like IT is doing something to them. They want to feel like they're being brought along, that they have a hand in the decision, that they're a partner of ours, that we're working to solve one of their problems. We understand their problems, and we're providing them a technology and a solution that helps achieve that. So again, for us, when we did our cloud strategy, because we had so many other organizational priorities, it was critical that we got buy-in from the senior leadership so that when we were going through the migration waves and we were having to take systems down for a couple hours to migrate, that they understood why, and they knew that this was supported by the highest levels of the organization as we were doing it. And also telling them the rewards and the outcomes and the benefits that they're achieving. I've never had a doctor once come to me and say, please make sure you run Epic in the cloud. They do not care where we run Epic. They just want to make sure that when they go to use it, it runs. And so moving something to the cloud for the sake of moving something to the cloud is not really worth the risk. But if I'm able to show additional rewards, either from a cost-saving standpoint, helping our analytics strategy, the implementation of AI technologies that can make their lives easier, reduce their burden and their workloads, then they're very excited about those opportunities. So IT is one of the few organizations within a hospital that literally works with every other department. Every other department is dependent on the work that IT does. So we have a unique advantage and a unique view into the organizations. And we have to be responsible and work to help each of those departments and deploy platforms across the board that help solve their challenges. And maybe if I could just add to what I was saying about platforms, we've really made a concerted effort at Stanford to focus on key platforms. So as part of our app rationalization work, when we were going through our cloud strategy, we realized that there's about 25 applications we could get rid of if we deployed an enterprise-wide ERP system. And that ended up being Workday. And so we're in the midst now of finalizing that deployment. So that's a platform for us. ServiceNow, that's another platform that we build off of. Same with Epic. So what we're trying to do is not necessarily be best of breed. We're trying to say which platforms can get us 80% of the way there and say that's going to be okay. Because that other 20% is typically bringing additional cost to the healthcare system that's not justified or needed. They might be nice to haves, but they're not needed. And so Gary and I are really working hard to get that message through the organization, because every year we fight the battle of we need more money in IT, and the organization's saying we don't have money to give you. So we've got to work together with them and show them how this platform strategy is really helping the organization in the long run.
Excellent. So I think we just have about 5 minutes left, so I maybe want to get some closing thoughts from each one of you on the top 2 things you're most excited about, or the top 2 lessons learned that you'd like to share with the collective audience. We've covered everything from public cloud to AI deployment strategies to some of the emerging technologies. But Dr. Khan, let's start with you. What are the top 2 things you would want to share from a consideration aspect, or maybe what you're excited about?
I think what I'm really excited about right now is that we are seeing an impact within our clinicians' lives and our patients' lives as these tools and services are both brought into the cloud. And I'm very AI-centric, seeing how AI is actually having a really substantial impact. Whether it's for my colleagues who have to spend, say, less time just typing in front of their electronic health record systems, they can go home earlier. They're not doing pajama time, which is when you're working at home. And I think at the same time, too, is tools and services that are adaptive to patients, right? Finally, individuals who previously didn't have access to tools can get those things through generative AI in their own language at their own educational level. So I'm really, really excited about those opportunities emerging right now.
So the future's really bright for IT, for cloud, for AI. The most exciting thing happening now, I think we all believe, is generative AI. We've got 2 projects, actually 2 deployments that we're doing in that space. One for a draft response for provider in-basket messages, and one for ambient voice in clinics, provider and patient in the room, to create a progress note. The data that's coming out of those 2 projects is unbelievable. The first one, the draft in-basket, is actually a rigorous test that we did, an experiment we did, that will be published very soon in a peer-reviewed academic journal. We're really excited about that. Can't talk much about the outcome other than to say, yeah, there's a very strong indication that we are statistically significantly reducing cognitive burden of a physician by using AI, Gen AI, in the draft in-basket response space. From the perspective of ambient voice, similar really good data, really strong data suggesting time recovered by providers out of their really busy schedule to do things they need to do, other things they need to do. We're really excited about those. And in both cases, they're moving the needle on physician burnout more than anything I've ever seen. And these are early days of ambient AI, not yet tuned, not in instruction tuned, not yet fully trained in healthcare specific data sets. It is as exciting a time as I've experienced.
So I would leave you with 3 thoughts. The first is make sure you surround yourself with good people. I am so fortunate to have an amazing team back home. They really make everything happen. I'm the voice here talking about the work that they do, and they're an incredible team. So make sure you have a good team, and not just technically, but make sure you have people that can collaborate well with others. And I think it's so important that the people you have on your team can talk to the business, understand their needs, not just sit there and be order takers. The second thing I'd say is make sure you have really good strategic partnerships. So whether it's with companies like Nordic or AWS, rely on your partners, build strategic relationships, have them help you get to your goals. I think it's really important. And the third thing is put pen to paper or put fingers to a keyboard and get your cloud strategy defined and written out. Don't put it on a shelf. review it, and be nimble. The future is going to change, and what you think is going to happen in 2030, I suspect won't come out exactly as you think today. So as we've developed our strategy, I know that we have to review that quarterly and annually to make sure that we're still on the right track. So those would be my 3 key takeaways.
Fantastic. Thank you. Gentlemen, thank you so much for your partnership. We greatly appreciate your time. We're better together. Can't say enough about how much we thank you for sharing your knowledge, both positive and maybe some of the lessons learned along the way. Hopefully everybody in the audience can take something away from that today. I have a big red number on a screen up here that suggests we're over time, so I apologize for that, but I think most of us will be around after our discussion right now to take some questions, maybe offline. We also have an event this evening where all of us will be at the Conrad at 6 p.m. If you want to come, you're welcome to join for a social hour and maybe dive into some of these topics a little bit further. Thanks, everybody. Appreciate it.
Yeah, hi, George Margellis from Australia. So 10 years ago, I worked with Intel, and one of the big projects we worked on then was moving healthcare to the cloud, which was a very successful project, and most of our public hospital infrastructure is now there. 10 years later, when I meet with those CIOs, they tell me about, the platforms have worked well, there's a lot of interoperability, all those benefits, but they always complain about their cloud hosting costs going up. So managing cloud hosting costs becomes a challenge, both from the IT department and obviously finance and for profit. Any comments on about how they can leverage both on-prem with cloud to sort of make sure that cost blowouts don't cause significant challenges?
Do you want me to take a shot and you can take it then?
Yeah, sure, go ahead.
All right, so from an application perspective, I would look at certain key events in the application development lifecycle. So if you have an on-prem application that has a large bit of hardware that's supporting it, and the hardware is end of life, you're looking at a huge, capital investment. Great time to look at cloud strategy. If you've got a vendor who is thinking about going to a SaaS model completely, negotiating a good deal with the licenses you have and taking them there with an understanding of the TCO can work. Costs are coming down. They are legitimately coming down in the cloud, but you really need to understand what your cost levers are, egress fees or what have you. We would never move an application to the cloud that wasn't economically the right thing to do. It doesn't make any sense. So if it's the operating cost plus the depreciation expense of the capital, and it should be equal or greater than what the cloud option is. And it's pretty straightforward.
Yeah, I think Gary, addressed a lot of your points. The only thing I would say is not every application currently is built to be in the cloud, right? So to the extent that they can bring things on-prem and maybe look to burst, right, to the cloud when they need it, that's one of the things that we're looking at too. More and more applications are able to do that. But like I said, I think over the next few years, you're going to see more and more vendors offering SaaS solutions, which is going to drive you to have to go there. Because if you stay on-prem, they're not going to give you the feature sets that you want. They're going to quit developing for the on-prem application. It's probably not cost effective, but that's just the reality. They're going to drive you that way. But to the extent you can look at using the cloud for bursts, as opposed to having all of that hardware just sitting in your on-prem data center, that makes a lot of sense.
All right, we have another question over here.
Hi, my name is Shadow. I am an IT specialist. We are currently developing an app, health care. So I wanted to ask you, how do you balance the need for innovation with the security and privacy concern in cloud-based healthcare solutions?
So that's a great question. There is a case to be made that cloud can be safer. And the reason is you can put a modern security envelope around it and protect the egress and of it. So it's very important to understand what your overall cyber strategy is. It's really expensive to protect every little on-prem system that you have because you're dealing with operating system releases that are late, behind, that have known exposures. And if you can get into the cloud environment with the right kind of monitoring, you can really make it cost effective and ultimately safer. But it's worth remembering that cyber doesn't stop with the applications that you own. It's also the applications that every supplier owns that helps you. So when we're thinking about cyber, at least I'm thinking about cyber, I'm looking at the supply chain to find out if where we're buying medications or OR supplies has equally robust cyber protections, because that can break you as well. If you can't get medication at the right amount at the right time, you'll have to stop operations. So think cyber, supply chain, all directions.
You know, being part of AWS, we've done a lot of thinking on this. Like, we've published a lot. You can look up something called the well-architected framework. It really lays out how to approach this in a meaningful, scalable sort of way. So hopefully that addresses the question as well.
Do we have any more questions from this side? Chris? Yeah, question over here.
Thank you for the very insightful conversation. I have a question that has two components. The first is, where does Stanford Health believe that, where do you believe AI is going to have the greatest impact in terms of improving the quality of care? And on the other hand, where do you believe it's going to have the greatest impact in reducing the cost, taking into account, of course, infrastructure and cloud costs as well?
The answer is all the above. So healthcare, all of the applications in our portfolio will ultimately have some model somewhere. It's inevitable. On the clinical side, what we're seeing is there are certain applications, that predictive models that can help predict lots of different things that inform the physician. So they are adjunct to the physician normal workflow. There are, in the generative model area, the Gen AI area, it's transformative. You know, taking huge cognitive burden off the physician will be extremely important from a wellness perspective, not really from a revenue perspective, certainly from a quality perspective. On the financial side, lots of room for opportunities. We've got an application right now we're running that is looking at pre-auth denials for on our revenue cycle. Well, pre-auth denials are a real problem because it ultimately can interrupt care, but it costs a huge amount of money to figure out why the procedure was denied. So we've got a model now that looks at these denials, looks at the data we submitted, and suggests information in the out of our Epic or other electronic health electronic records, and packages it in a way that a pre-auth person can say, yep, that's what we forgot to send. We send it, and it works. So there's real dollars, there are hard dollar savings in the revenue cycle applying AI models in the right place. And I don't think there's going to be one or the other. I think it's going to take, all boats will rise with AI.
I would say the other thing to add to that too is I think the real opportunities are going to be look at precision medicine and actually, medicine for the individual. I think the advantages of AI right there are going to be incredible. I don't think we even begin to understand how important that's going to be in 10 years from now. So I think we are going to be much healthier as a society because we're going to intervene earlier. We're going to know in advance what may be coming down your way and look for that. So I think that's going to be incredible for us as a population of what AI is going to do. The other thing I'd say is, like Gary said, there's a lot of room for incremental improvements with AI to margins and efficiencies. But I'd argue that's not really transformational. And when I think about healthcare, at least in the US, healthcare has been the same for the last couple hundred years. When you get sick, you go to the doctor, you go to a building. How do we transform healthcare, and how do we actually bring healthcare to the patient at home? Why do we have to go to a hospital anymore? So I think if we can look at ways that we can take AI and adopt and actually find ways to reduce lengths of stays, get patients out of the hospital sooner, get them to the environments they want to be with families, I think there's a huge opportunity there to transform healthcare from the traditional model that we've had. We've got to find ways to pay for it. We've got to work with the payers. We've got to work with the regulators to get them to understand this new model, that it's beneficial for society. So there's a lot of work to be done, but I think the opportunities are huge.
Thank you for your time and for answering all of the questions. My name is Dr. Dyer. In particular, I'm very excited to see Dr. Khan up there. It's very exciting to see clinicians represented in the tech industry. I can't remember who mentioned it, that clinicians just want a better mousetrap. Yes, we do. but we are also getting to a point where we want to be a part of the transformation. We want to be a part of the conversation. And I'm sure you know that digital health adoption for clinicians and individuals alike is very low. And that's because on the clinician side, there's a lack of trust in the system. So for all you techies putting all the amazing things together, I think we have to find a way to collaborate with clinicians and bring them on board at ground level so they can be a part of it and they can trust it as well. Thank you.
Yeah.
Very good point.
Totally agree. Totally agree. And when I think about, so I've been I put my first electronic health record in 1999. So I was the original SIN for healthcare a long time ago. And I would tell you that I don't think I put anything in that wasn't requested by either a doctor or a lawyer. Never an IT person. So, and everybody had well-meaning ideas, but for the last 25 years, we've created an unworkable infrastructure. So unwinding that is super important. I completely agree. Physicians, and at least at Stanford, physicians are taking a lead. Our CIO is a physician, actually a practicing physician. Our CMIO is very active with us. So I think that's turning, but we have to take it apart. When we were talking about where you can get the best value for technology, I came up through business school, and the Peter Drucker, who was a management consultant, wrote seminal books on efficiency and management and that sort of thing. And he said, and if I can quote him, if I can remember what it is, he said, "There's nothing quite so useless as doing with great efficiency something which shouldn't be done at all." So unwinding this whole thing is really the job for us. AI can help, but you don't want to automate something you shouldn't be doing. You want to rethink the whole transformation, means rethinking the whole workflow. So thank you for the question, though.
And thank you so much, Christian, Kevin, Gary, Naki. That's going to be it for the questions. We can move on to our next topic. Thank you so much.